My weight ballooned to like 250 pounds. My wife and I separated. I was living on my own, and I knew I had to get serious about my health. I mean, what am I going to do? How am I going to date again? So I started eating better. I started exercising more, and I was losing weight. And I got a male hormone health panel. These are the things that you're supposed to do when you get into your 50s and you have some blood drawn. And they tell you what your cholesterol is doing and all those things. One of those things is the PSA, prostate specific antigen. And mine came back elevated. And so I got to go online and I got to read about something. What is this PSA? It turns out the PSA is associated with increased risk of prostate cancer. It means your prostate is inflamed, and that could be because of cancer, but it could be because of any number of things that are sort of normal for a man that age. But in my head, it's cancer. Your brain starts playing tricks on you, and I don't have to tell you because you've actually been through it, and I just had a bad blood test. So, the advice on the internet is, well, when was your last prostate exam? Like, I haven't had a prostate exam. Are you kidding? I don't want to go to the doctor. I've been dodging doctors for 15 years. I promised my son that we would take care of him at home and he would never have to go back to the hospital because I felt so much shame of having treated him the wrong way, of not knowing what was going on. I said, we're going to figure this out together. I haven't had a prostate exam. And so the internet says, well, are you having difficulty urinating? And I became so self-conscious about my own urination that I started having difficulty urinating. And my head is going bonkers. I don't want to get a prostate exam because the next thing is going to be a biopsy. And the next thing is going to be a prostatectomy. I was talking with other men who had been down this road, and it was awful. There was one man who had a sepsis infection that threatened his life as a result of his biopsy. There were several men who had prostatectomies, and they were never going to have an erection again. And it was just something that they sort of accepted. They said, but I'm glad we caught it early. And here I am. I'm a single guy now. What woman is ever going to love me if I have no capacity to have an erection? All these things are going through my head. I said, I'm not telling anybody. I'm not telling my daughter. I'm not telling my son. I'm not telling my wife. I'm going to handle this on my own. I'm going to do everything I can to avoid the doctor's office or die trying. So that was keto, and that was ice baths. That's when I got really serious. Every day I will get into that ice bath. And sure enough, I brought my PSA down from 7 to eventually 1.5, which is normal, no elevated risk. And so you can see how stubborn I already became and how I'd learned about metabolism because of my son's diabetes and how I'd already sort of trained myself to disbelieve what the doctors were saying. And so I'm going to do this myself, right? I got the PSA 1.5. That was good. And so I finally go to see the urologist. I'm thinking I'm going to clean bill of health, a pat on the back, a congratulations, right? For being so clever to have him. That's not what happened. I gave him my labs and he said, well, I want to do one more test. And I thought, am I in trouble here? Is there still a risk? He said, well, you just get this one more number. He did not care about my PSA. I was totally in the clear, but he saw that my testosterone had gone through the roof. I was at 1180 nanograms per deciliter, which is too high, the lab report said. I had the testosterone of a 19-year-old, and he was about my age, and he thought, this guy must be juicing. He must be injecting himself with testosterone. He must be doing something to elevate. He wanted to measure my luteinizing hormone. I didn't know what that was. Luteinizing hormone is what stimulates your gonads to make testosterone. So if your luteinizing is low, but your total testosterone is high, then the endocrinologist would say, hey, Professor Seager, you better get off the TRT. You're overdoing it here. Luteinizing hormone came back 8.9, way off the charts. And I never heard from my urologist again. And I haven't gone back, I don't have prostate cancer. I'm not worried about that. I have extremely healthy testosterone levels. What I've learned is there is no reason for a man's testosterone to decline with age. It's normal, but that doesn't mean it has to be. I don't want to be normal. I'm ready to be abnormal because normal these days is in a state of chronic illness. When you take care of your metabolism will take care of your testosterone. So I check about once or twice a year now, and I'm not 1180, I'm 1040. And many men are still saying 1040, that sounds great. For me, it's very healthy. Then a funny thing happened. Joe Rogan found my article. He read out an Instagram post, but he's like, there's this guy and he has these testosterone levels because he does his ice bath before his exercise, which is the opposite of what everybody says you're supposed to do. So Joe's trying it and he goes, it's really hard, but I think it's working. Men started reading my articles and they started sending me their labs. And I'd say about 80% of the messages that I get, they sound like, I think you found the cure for low T. I tried your protocol. I got off TRT and I'm getting like 900 readings and I want to go higher. Some of them are saying it feels like I'm doing everything right and I'm stuck at 550. Now, I don't know. I mean, testosterone is both psychological and physiological, but there's some good science to support what happened to me, that the mechanism is cold exposure, cold stimulation. It doesn't even have to be whole body. You can do this with a cold shower. And then some exercise. It doesn't have to be a lot of exercise. It can be a brisk walk. It can be the stair climber. It can be, I do push-ups. I do pull-ups sometimes. I have my steel mace. There's a video of me on the internet, and that's my favorite one. But you don't have to lift heavy. And what happened to me is also happening to the men participating in these scientific studies. It's not a guarantee that it will work for everyone, but there's no side effects except feeling wonderful. So why not give it a try and see what happens for you?